Hey there, this is Dr. Steinbacher with you again today, and I want to talk about an area that's really near and dear to me and an area of big interest related to jaw surgery, nasal function, rhinoplasty, and that's nasal changes and orthognathic surgery. So many patients coming and presenting and needing orthognathic surgery, often there can be a nasal deformity or issues with nasal function concurrently. And just a word about sequence, it's always better to have the jaw surgery, orthognathic surgery done first, and the rhinoplasty be done second, because when you think about the jaw position, this is the foundation of the nose, and we want that foundation to be set. Moving the jaws may also change the nose, the nasal appearance and function, so we want to get that component done as phase one, or the first stage in a sequence. So don't have a rhinoplasty and then jaw surgery. It should always be jaw surgery, then rhinoplasty. The other scenario is based on how we move the jaws. This can have a positive impact on the nasal appearance and function. It can be somewhat neutral, where there's really no change depending on how we've planned and moved the maxilla, or it can make the nasal function or appearance worse. So ideally, we want to be able to predict how things are going to change and have that in the plan in advance that, hey, after the jaw surgery, your nose might look worse, might function a little bit worse. Most of the time, the functioning is better because we're tending to widen the bony nasal cavity. We're removing some of the nasal obstruction, but anything above the area or superior to the maxilla, to where the nose is, that we're not altering, we wouldn't expect a change, meaning if there's enlarged middle turbinates or very significant septal deviation or internal valve collapse, things along those nature, that's not going to improve with jaw surgery. But often the overall nasal cavity volume will be improved, and this will improve your nasal function after jaw surgery. But there are things that can worsen with jaw surgery. The alar base, or the width of the nose, can widen to an extent, and this may be beneficial or it may be unesthetic. The nasal tip and tip projection can sometimes lessen. Sometimes if there's a dorsal hump or a bump on the nose as the jaw comes forward, this can lessen a little bit. So some of these things can be positive, some are negative. By the way, we do several things during the jaw surgery to try to minimize negative changes, such as what's called an alar cinch to prevent excess widening. We also come underneath the anterior nasal spine and bone graft between there to ensure that the posterior septal angle, which is a component of the nasal tip projection, is well supported. And this is important when we're coming back for a rhinoplasty as well. We've written papers about the times that rhinoplasty is needed after jaw surgery, and there is a proportion where this is really going to benefit both aesthetically and functionally. Folks have snoring, sleep apnea concerns. The majority of that correction is going to come about from the jaw and orthognathic surgery, but icing on the cake will certainly be rhinoplasty, septoplasty. But you can imagine that if you do the nose first, you're still hitting a bottleneck where the tongue is and the palate. It's sort of like having a 6-lane highway that comes into a 2-lane tunnel. You want that tunnel as big as possible first, and that whole airflow from the nose down to the posterior pharynx to be improved. Anyway, there's a lot more about this topic we could go on to discuss, but needless to say, jaw surgery, dentofacial deformities, facial and malocclusion, sleep apnea, snoring, these are all related, and these can be really positively impacted by orthognathic jaw surgery plus septorhinoplasty. And I feel I'm in a unique position in this scenario because I'm one of the few that do a significant amount of orthognathic jaw surgery and a significant amount of rhinoplasty. Typically these areas are dealt with by various specialties, but my training and background and interest has always been in orthognathic jaw surgery, rhinoplasty, in the intersection of the two. I think these are some of the most powerful procedures from a functional and aesthetic perspective, and understanding the jaw and how that relates to the nose and really understanding rhinoplasty puts us in a great situation to improve the balance, improve the function. Thanks so much for listening, and we'll chat again soon. Like this video, please check out our channel for additional content related to jaw surgery, plastic surgery, maxillofacial, and rhinoplasty. Please follow us or like any content as well, and check out in our bio additional links to our website and other social media platforms where you can find this and additional content. Thank you.